Hey folks, Dr. Jeff Williams with Creekstone right here in beautiful Amarillo, Texas. And I was doing some Googling and I noticed that one of the most popular searches was, how much should I go to the chiropractor? Well, let's talk about that because there's some stuff I need to debunk a little bit. One of the myths is that once you go to a chiropractor, you've always got to go to a chiropractor. That's not true at all. You should go through a short treatment span and resolve your condition and then not need a chiropractor until you have another injury. Then there's another myth that lots of chiropractors, they're just going to see you a million times throughout your whole life. Well, not true here at Creekstone, okay? So let's talk about how we set up our patient schedules, okay? This is a sign I made for our exam room to make it super simple for our patients to understand. Pain comes in acute, subacute, or chronic, okay? So acute means that you've had pain for less than a month. Those patients, they see us 3 times a week for 2 weeks. Subacute patients mean the pain has been going between 4 weeks and 12 weeks, and those patients should see us twice a week for 3 weeks. And then we've got chronic, long-lasting pain, basically anything that's been going on for longer than 3 months. Those patients start with 2 appointments per week for 4 weeks. Now, when we get to the end of those plans for those specific categories, if you're feeling great, then we begin to slowly withdraw from care, trying to prevent the injury from returning. So, for example, if we were seeing you 3 times a week for 2 weeks and you're doing great at the end of those 2 weeks, well, then we're going to see you only twice that next week. Doing great? Okay, we're going to cut that down to once. Doing great? Then we're going to kick out 2 weeks in between, 3 weeks in between, and then a month. When you can control yourself, you can control your pain at home, then we're done. We are good to go. Now let's say we get to the end of the initial protocol and you're not doing great. Well, if there's been little to no improvement or you got worse for some reason, then we're going to change things up. We're going to try a different code. We're going to try different treatment and see if we can affect that. Ultimately, if we just can't, we're going to try to find you a provider that can help you. So see, it's about as simple as that. You've got acute, subacute, chronic, those treatment categories in there, and boom, we're off and running. Super simple. As evidence-based, patient-centered chiropractors, my job is to make sure that we get your condition resolved, and then you can self-manage any little aggravations at home without any issues. You don't need to call us. You don't depend on our office for your ongoing health. However, if the pain comes back in a way that you can't self-manage, that's when you give us another call and we get started and doing our part to get you resolved, okay? Call us at 806-355-3000 and let's get you to feeling better.